Hi, my name is Callie, and I'll be your nurse practitioner student today. And let me go ahead and wash my hands, and we'll begin our exam. So I'm going to have you lie back, and we'll be assessing your abdomen, your musculoskeletal system, neuro, and your spine. So first, I'm going to have you lift your shirt, and I'm just going to take a look at your abdomen, assessing the contour, shape, symmetry, looking for any scars, protrusions, any vessels. And then I'm going to take a listen. Just listen to the 4 quadrants of your abdomen, listening for your bowel sounds. Then I'm going to listen for any bruits at your aorta, your iliac arteries, and your femoral arteries. Good. And then I'm going to percuss your general abdomen, just assessing for any tympany and dullness. And then I'm going to percuss your liver. So the span between those 2 points is your liver span, and then I'm going to percuss your spleen. Take a deep breath. Good. Then I'm going to percuss your bladder. Great. Next, I'm going to lightly palpate all 4 quadrants of your abdomen just for tenderness or discomfort. So tell me if you feel any discomfort.
No.
Good. And then I'm going to palpate your liver. Come on this side. Take a deep breath. And then I'm going to palpate your spleen. Attempt to palpate. And then your kidneys. Next, we're going to move, we'll do the CVA tenderness when you sit up, but first I'm going to take a look at your lower extremities, move on to your musculoskeletal system. So I'm just looking for any redness, any redness, tenderness in your legs, and then also for any peripheral and pretibial edema. And then we'll assess your range of motion and active range of motion and against resistance of your hips. So first I'm going to have test abduction. So I'm going to have you lift your leg and then move it away from midline. Good. And then adduction is moving it back to midline. And then we'll do it against resistance. Good. And then, good. And then we'll test your other one. So abduction is away from midline. And then adduction is back. And then against resistance. Good. Perfect. Next, we'll test flexion. So I'm going to have you bend your knee to your chest. Good. And then extension is just releasing. And then against resistance. Good. Good. And the other. Good. And then next is internal and external rotation. So I'm going to have you bend your knee at a 90 degree so you can keep, so kind of like this. And then in. Good. And then against resistance. And then internal rotations in. Good. And we'll do your other. And then against resistance. Perfect. Good. So then I'll have you sit up and we'll move on to your knees. So we'll have you first flex your knees. Good. And then extend. Perfect. So then bring it down so it's flexing against resistance. And then extending. Good. And then down against resistance. Good. And then for internal and external rotation, so while you're sitting, have you turn your foot towards midline and then away from midline. Good. And then your other. And then we'll do against resistance too. Both. Good. Perfect. And then next your ankle. So inversion and eversion. So I'm going to have you bend your heel inward and outward. Okay. Against resistance. Wonderful. And then dorsiflexion and plantar flexion. So I'm going to have you point your foot downward and upward. Good. And against resistance. Good. And then while you're sitting up, I'll assess your CVA tenderness. I'm just going to, just let me know if you have any pain. Okay, so next we'll move on to your upper extremities. So I'm going to inspect and palpate your shoulders, your acromioclavicular joints. I'm just going to compare them for any swelling or tenderness. And I'm going to have you, we'll assess range of motion of your shoulders. So for abduction, I'm going to have you raise your arms to the side and overhead. Good. And then against resistance. Good. And then for adduction, so I'm going to have you move your arm across your chest. Good. And against resistance. Good. And then for internal rotation, so have you place one hand behind your back on your shoulder blade. Good. And against resistance. And the other side. And then external rotation is place one hand behind your neck, like you're brushing your hair. Good. Good. And then forward flexions, raise your arms in front of you and overhead. Good. And then extension is have you move your arms behind you. Good. Great. And then move on to your elbow. So I'm just going to inspect and assess your lateral and medial epicondyles. Just looking for any nodules and swelling. Great. And then we'll assess your active range of motion and against resistance. So for flexion, I'm going to have you just bend your elbows. Good. Against resistance. Good. And then extension is just to straighten. So I'll have you do it and then against resistance. Perfect. And then supination is have you turn your palms up like you're holding soup, carrying a bowl of soup. And then down is pronation, turn your palms down. And then for your wrists, I'm going to, for flexion, point your fingers towards the floor. Good. And then extension is point your fingers towards the ceiling. And then we'll do against resistance. Good. And then abduction is with your palms down, bring your fingers towards midline. And then adduction is away from midline. Next, I'm going to assess your hands and fingers. So I'm just going to palpate your joints, your MCP, PIP, and DIP joints. Good. I'm just looking for any swelling or bogginess or any tenderness. So first, then I'm going to assess your grip. So grip my hands as tight as you can. Good. And then flexion, make a tight fist. And then extension is spread your fingers. Good. And then adduction is spread your fingers apart. And then abduction, and adduction is bring them back together. Good. And then opposition is touch your thumb to your fingers. Good. And then I'll inspect your back. I'm just looking for the curvature, looking for any lordosis, kyphosis, or scoliosis. And then also I'm going to palpate your cervical spine, your thoracic spine, and your lumbar spine, and then any of the paravertebral muscles bilaterally. I'm just looking for any spasms or tenderness. Good. So next we'll move on to neurologic exam. So I'm going to assess your mental status. So just tell me your name and birth date.
Brett Lesher, 7/24/84.
And where are we?
We're in our house in Leesburg.
Good. And then what is the month and the year?
It is April 2015.
Good. So then to test your recent memory, I'm just going to ask you to remember these 3 words: daffodil, cheese, coffee.
Daffodil, cheese, coffee.
Good. So remember those. And then to test your remote memory, tell me what you did for your birthday last year.
Played softball and went for a bike ride.
And then as far for reasoning, just tell me what the following proverb means. Don't count your chickens before they hatch.
Don't get ahead of yourself.
Good. And then to test your attention with serial sevens, start at 100 and subtract 7 and keep subtracting 7.
100, 93, 86, 79, 72, 65, 58, 51, 44, 37, 30, 23, 14, 7, 0.
Good. And then tell me what those 3 words were.
Daffodil, cheese, coffee.
Good. Next we'll move on to your cranial nerves. So first we'll test optic nerve number 2. It's by your visual fields by confrontation. So I'm going to have you close or cover your left eye. And then just tell me when, you can look at me, tell me when you can see my fingers.
I can see him. I can see him. I can see him. I can see him.
Good. And then cranial nerve number 3. Oh, well, sorry, we'll switch eyes.
I can see him. I can see him. I can see him. I can see him.
Good. So then we'll move on to cranial nerve number 3, 4, and 6. Oculomotor, trochlear, and abducens. So I'm just going to assess your extraocular movement. So just with your eyes, follow my finger. Good. And then for cranial nerve number 5 is the trigeminal. So first we'll test sensory and then we'll do motor. So I'm going to use this Q-tip. This is sharp. This is dull. I'm just going to touch different parts of your face and tell me if it's sharp or dull. So have you close your eyes.
Sharp. Dull. 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 Sharp. Sharp.
Good. And then for the motor part of this cranial nerve, I'm just going to palpate your masseter and your temporal. So clench your jaw. And then move your jaw back and forth. Good. And then for your cranial nerve number 7 is your motor. So I'm going to have you elevate your eyebrows. Close your eyes tightly so that I can't open them. Good. Give me a frown. Smile. Show me your teeth. And puff your cheeks. Good. And then for cranial nerve number 8 is the acoustic. So I'm going to first do the whisper test. So I'm just going to cover your left ear and whisper. X19. Just tell me what I said.
X19.
Good.
X19.
Good. And then for a Weber test, I'm going to use the tuning fork. So I'm going to vibrate it, place it on top of your head, and then just ask if you can hear it on both sides or just one side. And then for Renee test, I'm going to hit the tuning fork, place on your mastoid bone, and then ask you when you stop hearing it, I'll place it in front of your ear, and then see if you can still hear it. And you should still hear it longer. And we'll do the same on the other side. Cranial nerve number 9 and 10 is the glossopharyngeal and vagus nerve, but testing the gag reflex, but we won't do that at this time. And then cranial nerve number 11 is the spinal accessory. So I'm going to have you shrug your shoulders and then turn your head against my hand and this side as well. Good. And then the last is the hypoglossal cranial nerve number 12. So I'm going to have you stick your tongue out. I'm just looking for any symmetry, any deviation, and then move your tongue back and forth. And then this one we also look at articulation, which you've already articulated well. And then next we'll assess your cerebellar function. So I'm going to have you rapidly put your hands back and forth on your lap as fast as you can. Good. I'm just looking for speed, smoothness, and rhythm. Perfect. And then I'm going to do finger to nose. So I'm going to have you touch your nose and then my finger. And then this I'm also looking to see if you have any tremors as well. Good. And then we'll switch hands. So no tremors with intention, and then just look, see if you have any tremors at rest. Good. And then last is proprioception. So I'm going to have you, I'm going to ask to identify if I'm moving your toe, finger, and wrist up or down. So this is down and this is up. Okay. So close your eyes.
Up,
Good.
down, up.
Okay, we'll do your wrist.
Up, down, down, up.
Good.
Down, up, up, down.
Good. Next, we'll test sensation on your upper and lower extremities. So first, we'll use the Q-tip again. Again, this is sharp and this is dull. And so I'll do different parts of your arms and we'll do your legs as well. So
Okay.
Close your eyes.
Sharp, dull, 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 sharp, sharp,
Good.
dull, sharp, sharp, dull, sharp, sharp, dull.
Good. And then next we'll do light touch with the, I just have a gauze. So close your eyes and just tell me when I'm touching you.
Touching, 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 touching.
And then next is the vibration sense. So with the tuning fork, I will, hit it and have it vibrate and then put it on your hands. And then you'll just let me know when the vibration stops. So I'll go start in your hands and move up, and then do that bilaterally, and then also start in your feet and move up, and just tell me when it stops. And then the next thing is test stereognosis. So I'm going to place, some of you close your eyes. And then so I'm going to have you tell me what objects are in your hand. So if you can open up first we'll start with your right.
A ball,
Mm-hmm.
a writing utensil,
Do your left.
a writing utensil, a ball,
And you can open up your eyes. Next, we'll test your deep tendon reflexes. So I would have a hammer, but I'm just going to use my stethoscope. First, we'll test your biceps. I'm going to have you just relax your arm on your... Perfect. I'm going to hit my finger. Good. Do the other side. And then we'll do your triceps. Good. And then your brachioradialis. Good. And then your patellar. Good. And then your Achilles. And then the last is your, we'll test your plantar flexion for Babinski sign. So with the handle of the reflex, I'm just going to strike at the bottom of your foot. I'm just looking for whether your toes fan out. Okay, good. So then I'm going to have you stand. And the last part of our assessment is just assessing your lateral bending and rotation. So I'm going to have you move from back. Good. And then twist, from rotate your body from right to left. Perfect. And then I'm going to have you walk across the room, just assessing your gait. And have you come back. Good. And then I'll have you walk on your heels. And then walk on your toes, coming back. Good. And then lastly, I will assess for Romberg. So I'm going to have you close your eyes and stand with your heels together. And I'm just looking to see if you lose balance or not. And that is our exam. That is it. Thank you.
Thank you.